Holiday traditions are supposed to make you feel warm and cozy, but sometimes they can take an ugly turn, something emergency room physicians know all too well, like teetering on a ladder to string those twinkle lights up. We'll talk about that right now in today's Health Watch. Joining me right now is Dr. Raul Gosthe. He's an orthopedic surgeon over at HCA HealthOne Presbyterian St. Luke's. Doctor, thank you so much for being here. We appreciate it.
Oh, thank you for having me.
Of course. So you recently performed a hip surgery on a patient who fell while decorating their house. So how often do you see injuries like this from falling or decorating?
So you're correct. I did just do that surgery, and unfortunately, we see it all too often. It's something that patients they don't realize just how dangerous these mundane activities can actually be.
Yeah. You know, when you talk about the holidays, though, I mean, you're going to have maybe like a drink or two, right? So how does drinking too much during the holidays impact what you do in the ER? What do you see?
Well, we know that alcohol destabilizes you, either mentally or physically.
Yeah.
And it also makes you think that you can do things you can't actually do.
Yeah.
And some of those things could be climbing a ladder, climbing a step, trying to get that Christmas ornament just a little higher because you think it belongs there.
Yeah.
And then unfortunately, gravity is undefeated and patients fall and they hurt things.
Yeah. I like what you said there. Gravity is always undefeated. So, I mean, bottom line, at least for that, is probably what? Drink in moderation, right?
Drink in moderation, yeah.
Right,
just the golden mean.
Yeah. And this time of year as well, you know, people usually eat more than they usually would, and maybe not that foods that agree with their digestion.
Yeah.
So how do food choices make people vulnerable during the holidays?
Well, bad food choices, especially if combined with alcohol, you end up not feeling your greatest. And when you don't feel your greatest, you will have more injuries.
Yeah. And then we're also seeing an uptick, and we've been reporting on this quite a bit here, an uptick in respiratory illnesses. So how do you think we can avoid getting sick around the chaos of the holidays?
Good sleep hygiene, good diet. Take some vitamins. To your point, right? Nutrition helps us fight bugs. So we eat well, sleep well, and stay warm.
Yeah. Out of everything that you see in the ER, what's been the most craziest thing that you've seen during the holidays? If you don't mind me asking that.
Oh, that's a bit of a loaded question. I mean, you know,
I'm sure you've seen a lot.
We've seen a lot. I've been in practice 9 years, and I used to work at a trauma center back in Florida.
Okay.
And so we saw a lot of crazy things. Can't say that one stands out more than the others, other than people falling off very high ladders trying to string those lights outside on their ceiling, or their roof rather. And getting some injuries, like open fractures we call it, where the bone makes its way out of the skin, and that's a devastating injury. Best to avoid it at all costs.
Oh man.
Yeah.
This is you mentioned you came from Florida. This is gonna be your first winter.
It's my first winter.
Are you seeing anybody get injured from shoveling snow? We reported on that too.
Well, aside from myself, I have not seen anyone else, thankfully, yet. However, you know, we are getting into the snowy season, and in particular in the spring season, from what I understand, it's a heavier snow. And so really the adage of lifting with your legs stands true, and you really want to make sure you have good form to avoid those back strains that we do see patients come in with.
Yeah, absolutely. Well, Dr. Gosthe, welcome to Denver, by the way.
Oh, thank you very much.
I appreciate you being here. Thank you so much. And you watch all of our health interviews, by the way, just go to our website, cbscolorado.com. Michelle?